What I'd like to do today is talk a little bit about erection problems and how we treat them by using penile implants. The most common causes of erection problems are related to vascular disease, that is, narrowing of the blood vessels throughout the body, and vascular disease is common in our society. Probably the other common cause we find are men that have had surgery in the pelvis where either the nerves to the penis or the blood vessels to the penis may be damaged, and that's most commonly surgery for prostate cancer, but also surgery for bowel cancer, and some other surgeries in the pelvis may cause the problem. The aims of our treatment are really to enable a man to have an erection that's as natural as it can be, as spontaneous as it can be, and really fits in with his lifestyle. Ideally, we want a treatment that has very few side effects or any risks associated with it. A normal erection really is a hydraulic event, that is, blood's pumped into the penis under pressure and the penis expands and becomes rigid. What we're doing with a penile implant is really replacing a blood hydraulic mechanism with another hydraulic mechanism in the form of cylinders and pumps which are implanted in the body. The best model of penile implant is what's called a fully inflatable penile implant, and it consists of three parts. There are cylinders that are inserted into the body of the penis. There's a reservoir of fluid that sits inside the patient's body adjacent to the bladder, and there's a pump which sits down in the scrotum between the testicles. And the patient is able to feel this pump through the skin of the scrotum and transfer fluid from the reservoir into the cylinders to fill the penis and mimic a normal erection. So these penile cylinders are within the patient's penis, within the normal compartments in the penis that get full of blood in a normal erection. So although this looks like it's a very artificial device, once it's inside the body, everything looks completely normal and no one else would even know there was an implant in place. What we're doing to cause an erection is we're going to pump fluid from this reservoir into the cylinders using the pump that's in the scrotum. So the patient needs to feel through the skin of the scrotum, identify the pump, and as they press on the pump, they slowly transfer fluid from the reservoir through into the penile cylinders. And you can see the penile cylinders start to arise. Now obviously they're contained within the penis so that they're symmetrical and they stay together. And as we pump them up, the penis becomes erect. The penis can be as hard as the patient wishes to make it. The harder they pump it, the harder it will get, and it completely fills the penis and really duplicates a normal erection. You can see the fluid is emptied out of the reservoir because much of the fluid is now in the cylinders. Another advantage of a penile implant is the erection will stay up as long as the patient wishes, because they need to press the deflation valve for it to go down. So what will be a completely normal erection that enables them to have sexual activity with normal sensation, normal ejaculation, is then totally under their control. When they've finished with it, they need to feel the deflation valve, press that once, and if they're prepared to sit and wait for a few moments, the implant will slowly go down by itself, and therefore the penis will go into a flaccid state by itself. You can actually see that going down now. You can speed up that process by gently squeezing the penis to push the fluid out of the penis back into the reservoir and therefore make the penis flaccid again. So it's a very normal erection in terms of how it's produced. The difference is we're pumping the fluid in rather than the body pumping blood into the penis. But in every other way, it's really duplicating a normal erection. Now, a penile prosthesis operation is done by making a cut on the front of the patient's scrotum. So all these components are put in through a small incision on the front of the patient's scrotum. If we imagine that this is the scrotum here with the pump inside it, this is inside the body and this is in the penis, an incision would be made on the front of the scrotum, and that enables us to put the cylinders in the penis, the pump in the scrotum, and the reservoir inside the body. And as I said earlier, there's nothing that would be visible to anyone else. It's all completely contained within the body. The penis looks completely normal when it's down, and as I've just demonstrated, it looks like a normal erection when it's inflated. The one thing I think patients are impressed about with implants and perhaps a little concerned about initially is that all the other aspects of sexual activity function completely normally. That is, the sensation of the penis is exactly as it was before. Their ability to have an ejaculation or an orgasm is exactly the same as before. So really what an implant is doing is restoring the rigidity of the penis for them, but all other aspects of sexual activity function exactly as they did. In other aspects, as I said earlier, I think an implant is the closest we can come to duplicating a normal erection. It has the advantage of being spontaneous for the patient. They're able to inflate it within a short time. It looks like a normal erection. They're able to deflate it whenever they wish. They don't need to consider whether they've taken a tablet half an hour before they want to have an erection. They don't need to think about injections and the inconvenience of putting injections into the penis. So certainly in terms of spontaneity, they're very good. Penile implants have been around in some form for about 30 years now. The current models are obviously much more advanced than the older models and have a lot of extra benefits. There have been a lot of surveys done over the years of the satisfaction rates of penile implants, and universally patients that have been counselled correctly and understand what an implant does always give a very high satisfaction rating. In the order of 89 or 90% of patients would say they're very satisfied. They would recommend that someone else has the procedure if they had the same problem, and it's fulfilling all the things they thought it would.